A very good morning to all of you. So today let's talk about ECG. So ECG is basically the electrical activity of heart. Okay. So I'm measuring or I'm seeing heart from the outside. Okay. So imagine a cricket stadium. Okay. So people do wave motion kind of things, right? So people don't move, but the waves move, right? Similarly, in a heart, I should measure the activity of the heart from the outside. Okay. That activity is done by the ions which is present inside the heart, the sodium and the potassium ions. Okay. So moving or I'm just recapping the previous videos. We talked about what is called as depolarization, we talked about what is repolarization, what is action potential, all those kind of things, right? So whenever a cell a neuron receives a neurotransmitter, okay, whenever a neurotransmitter is released, there is going to be stimulation of action potential, so there's going to be increased sodium ion influx. So normally the resting membrane potential for a heart muscle will be minus 70 MV. So this minus 70 MV, once the action potential is triggered, the influx of sodium, it is going to result in positive 30. So the action potential is stimulated, and over a period of time there's going to be potassium efflux, which is followed by sodium efflux, and there is going to be repolarization. Okay, this is the very basics I talked about in the previous sessions. So a neurotransmitter is released, sodium influx, cell the inside of the cell becomes more positive, action potential is triggered, and then slowly the nerve starts to again get back to the resting membrane potential. That is because of the potassium efflux, and later which is followed by the sodium efflux. Okay, so we talked about de and repolarization. So I'm seeing this depolarization and the repolarization in a small piece of paper. That is what is ECG. So ECG is the electrical activity of the heart. Okay. So now we all know that left ventricle, right ventricle, left atrium and the right atrium. Okay. So the right atrium, it has to pump the blood into the right ventricle. Left atrium, it pushes the blood into the left ventricle. Later it is pushed to the pulmonary and the aortic arteries. Okay. So imagine the right atrium. Okay, the right atrium, it receives the blood from superior and the inferior vena cava. It has to push the blood into the right ventricle, isn't it? So the right atrium should contract so that the blood in the right atrium is pushed into the right ventricle. Okay, of course there will be passive filling of the right ventricle, but once the complete squeezing or the complete contraction takes place, entire blood is pumped into the right ventricle. This is what is normally happening, and this activity is done by SA node. Okay, so SA node, it generate impulses, generate action potential, which in turn is reflected as the contraction of the right atrium. Okay, so the right atrium contracts and pushes the blood to the right ventricle. So initially the contraction of the right atrium is seen as P wave. The contraction of the right atrium is seen as P wave. Okay, now after the right atrium contracts, what is going to happen? There is going to be constant pressure in the tricuspid valve. So the tricuspid valve is the valve that separates the right and the right ventricle and the right atrium. So the tricuspid valve is put under a lot of pressure because the right atrium is filled with enormous amount of blood from the superior inferior vena cava. It is ready to open. Okay, that phase, that ready to open phase, is seen as a flat line. Okay, and then what happens? The blood is pushed into the ventricle, and the ventricle starts to contract, right? So the ventricle starts to generate the action potential, depolarization takes place, and it pushes the blood above into the pulmonary artery and the aorta. So the ventricular depolarization is what we see in the QRS complex. Okay, so P, Q, R, S. So P is because of the atrial depolarization. The atrium contracts. It's almost generating enormous amount on the tricuspid valve so that it opens and pushes the entire blood into the ventricles. And once it triggers, there's going to be ventricular depolarization. The pressure in the ventricle rises, so it tries to push the blood above, and that is reflected as QRS complex. Now after that, the ventricle relaxes. This is called as T wave. So this is the very basics. Okay, PQRST wave. So if you know this, ECG becomes a cakewalk. So PQRST. Okay, so there are a few intervals and segments. So if you have watched the previous videos, I talked about STEMI, NSTEMI, ST elevated, ST segment elevated myocardial infarction, non-ST segment elevated myocardial infarction. Okay, so if you have watched that, then this is called as ST segment. This region is called as ST segment. Okay, so the end of the S and beginning of T. So ST segment if you see, it is usually elevated in cases of ST elevation is seen in cases of STEMI, ST elevated myocardial infarction, and ST depression is seen in cases of myocardial ischemia. Okay, this is the first segment what we are learning here. So the next important thing is PR interval. Okay, so PR interval is the starting of the P to the starting of the Q. Okay, PR interval. So PR interval usually it is around 0.12 to 0.2 seconds. The interval is going to be 0.12 to 0.2 seconds. And PR interval, any abnormality in the PR interval or widening or a delayed PR interval indicates there's going to be first degree AV block. First degree AV block. Why AV block? As I told, what is AV valves? The tricuspid and the bicuspid valve. What it separates? The right atrium and the right ventricle, left atrium and the left ventricle. As I told you, the atrium contracts. There is going to be enormous amount of pressure in the AV valves. And then it opens, then the ventricular depolarization takes place. So that segment, that portion where it is receiving enormous amount of pressure but still not opening, that is what the flat line indicates. So any prolonged interval that is going to result in first degree AV block. Okay, now the next one is the QRS segment. Okay, so widened QRS segment, it indicates what is called as hyperkalemia. Okay, widened QRS segments indicates hyperkalemia and bundle branch block. So till now we talked about PR interval, QRS complex, that is the duration of the QRS complex if it is prolonged, what we see, and we saw ST segment. There is another one interval called as QT interval. So QT interval is the beginning of the Q, the end of T, QT interval. So it talks about the entire ventricular depolarization and the repolarization. Okay, so QT interval, if you see, if it is very short, that means the patient is having hypercalcemia. If it is more, then that is TORS D points. Okay, so there is PR interval, that is ST segment, QT interval, and QRS complex. Okay, so this is the very basics of a ECG wave. So PQRST, atrial depolarization, then there is going to be AV valves, they receive enormous amount of pressure, which is followed by ventricular depolarization, which is followed by the ventricular repolarization. Okay, now moving on, how these ECG leads are kept in the body and why it is kept, where it is kept. Okay, very simple terms I'll teach you. Okay, see, there are three leads. Okay, there are three leads: lead 1, lead 2, lead 3. Okay, remember, it has to be connected to a positive and negative electrodes. Okay, and one is kept as earth. So the right leg is kept as earth. Okay, I'm not going to connect anything. The right leg is kept as earth. Okay, so whatever connections I'm going to make is from the left leg, left arm, and the right arm. Okay, now lead 1, it connects the left arm to the right arm. Okay, so the left arm is positive, right arm is negative. Okay, lead 2 is I'm connecting the left leg to the right arm. Left leg is positive, right arm is negative. Lead 3 is I'm connecting the left leg to the left arm. Left leg is positive, left arm is negative. So this is what the leads about. So lead 1, lead 2, lead 3. Lead 1 is I'm connecting the left arm to the right arm. Lead 2 is I'm connecting the left leg to the right arm. Lead 3 is I'm connecting the left leg to the left arm. My right leg is kept as earth. Okay, it is ground. So this is what the lead connections is all about. And another one important is AVR, AVL and AVF. Okay, here there will be AVF, AVR, AVL, AVF. So AVR right side, AVL connecting to the left, and AVF is foot. Okay, very simple. Now this is chest electrodes. Okay, it is kept over the chest. So V1 it indicates the right lower sternal border. Okay, the right lower sternal border. And in contrast, V2 is left lower sternal border. Okay, so the right lower sternal border, left lower sternal border, V3 is present between V2 and V4, and V4 is the, as you can see, V4 is mid-clavicular line. Okay, and V5 is the anterior axillary wall. And V6 is the lateral axillary wall. Okay, or in some area they call it as mid axillary wall, whatever it may be. Okay, lateral or mid axillary wall. So these are all the chest electrodes: V1, V2, V3, V4, V5, V6. So V1 right lower sternal, V2 left lower sternal, V3 present between V2 and V4, V4 is mid clavicular line, V5 is anterior axillary, and V6 is mid or the lateral axillary wall. So now you have to tell me if there is any abnormality in V5, V6 that is going to indicate any abnormality in the lateral wall of the heart. Okay, the lateral wall of the heart, V5, V6. Any abnormality in the anterior wall is viewed by V4 and V3. Any abnormality in the right side of the heart, V1 and V2. Okay, so this is how the electrodes and the leads are kept. Okay, so we see patients lying down and lot of wires passing over them, and there is some wave patterns in the computer, right? This is what is active, this is what is actually taking place. So the electrical activity of the heart is measured with the help of leads and chest electrodes. Okay, so these leads, it measures certain parts and certain areas. See, imagine these leads and electrodes are like a camera. So I'm viewing the heart in the camera. Okay, so say for example, lead 1, left arm to the right arm, I'm viewing the left side of the heart. And lead 2, left leg to the right leg, similarly I'm viewing from the inferior view, so the heart is viewed from the inferior. Lead 2 and lead 3, inferior view of the heart. Lead 1, left side of the heart. And chest electrode V1, V2, right side of the heart. V5, V6, the lateral surface of the heart. And the anterior wall of the heart is viewed by V3 and V4. So I'm viewing the heart at different angles. So the camera used is what we call it as leads and electrodes. Okay, now we all know that ECG, it has PQRS waves, and another one important thing which you should remember is, see, there is something called as so the distance between one R wave to another R wave. R to R wave is one heartbeat. Okay, heart to heart is one heartbeat. Okay, so when I take an ECG, the most commonly used area to measure the heartbeat in an ECG is lead 2. Always remember, lead 2 is most commonly used to measure the heartbeat. So now I'll show you an ECG. Okay, I'll show you an ECG. You have to tell me what is the heartbeat. Okay, I'll tell you the very basics of the ECG, how to see. So you can see lead 1, lead 2, lead 3. We see AVR, AVL, AVF, and all the chest electrodes. So V1, V2, V3, V4, V5, and V6. So as I told you, lead 1, it connects the left arm to the right arm. Lead 2 is left leg to the right arm. Lead 3 is left leg to the left arm. So most commonly used lead to measure the heart rate is lead 2. Okay, so you can see that this is the R and this is the R. So as I told you, 1 R, the distance between one R wave to another R wave is what is the one heartbeat. Okay, now you see small boxes, right? So these boxes, okay, I'm just enlarging it and I'm just writing it for you. So imagine this is one big box. So each big box, it will have 5 small box in one row. Similarly, you have 5 rows. Okay, so 1, 2, 3, 4, 5. So 5 rows, and each row has 5 small boxes horizontally. So 25 small box is equal to one big box. Okay, now you see here, this is one big box. So inside a big box, you see 25 small boxes. Okay, now as I told you, one R to another R is one heartbeat. Okay, now in this case, I see 3 big boxes. Okay, so 3 big boxes I can see. How to calculate an heartbeat in these kind of situations is very simple. I will calculate one horizontal line from one R to another R. So I see 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 15 small boxes from one R to another R. Right? So I'm just measuring one line from one R to another R. I'm measuring how many small boxes I can see from one R to another R. I am seeing 15 small boxes in this patient. Okay, now how to calculate an heartbeat for this patient, her heart rate. Okay, so see, very simple. As I told you, there are 25 small box that forms one big box. Okay, so 25 into 60, that is 1 minute, right? So is equal to 1500 boxes will be there. 1500 small boxes will be there in this ECG. Okay, so how many boxes I see between two R waves here? It is 15. So what I'm going to do is I'm going to divide 1500 by 15. Okay, 1500 by 15. So in this patient I see 100 beats per minute. This patient I can see 100 beats per minute. This is how you calculate a heart rate. Okay, so one R to another R is one heartbeat. So how to measure? I'm calculating the number of small boxes present between one R to another R, a single line. So I see 15 small boxes from one R to another R. So I'm dividing the 15 by the total number of small boxes present, which is 1500. So approximately 100 beats per minute. Okay, now this is how you calculate a ECG. I'll show you a small abnormality, okay, in the next ECG image. So imagine a patient comes to you with a prolonged PR interval or an increased PR interval. Increased PR interval. I want you all to comment what is a diagnosis when you see an ECG with increased PR interval in the comment section. So I hope this video makes sense. This is the very basics of ECG, the leads, the chest electrodes, how you measure an heartbeat, what is AVR, AVL, AVF, and lead 1, lead 2, lead 3. So with this basics, you can answer the basics of ECG, and you can, read more stuffs, and you can dig into the ECG if you have time. So thank you so much for watching the video. Have a nice day.